So the procedure itself is a needle stick and injection into the veins, and it's done, right in our clinic, and it's pretty straightforward. You come in and lay down on our examining table, and just clean off the skin, and with the ultrasound, identify the particular vein that needs to be treated. And then, kind of like if you were to go to the lab for a blood draw, so that type of needle stick or a venipuncture will be done with a needle, but instead of drawing blood out like you would do at the lab, I would inject medication into the vein. And we actually watch that medicine going in with the ultrasound, so we know that it's in the place where it needs to be and that it's working. And how do we know that it's working? Because we see the veins actually shrink right in front of our eyes. They will be big, some of them very big, and then this medicine, the chemical, starts to irritate and actually damage the inner lining of the vein, and the veins react by contracting, and they get small, and you can see that happening right in front of your face. And so you know that it's working, and really, I'm not done until I see that, so sometimes these very large veins that have a lot of blood in them, it requires more medication to kind of displace the blood. And that's why it's a foam, by the way, because that foam takes up more space in the vein as opposed to it being just like a clear liquid. So the foam is actually that chemical, that liquid chemical mixed with gas, and it creates the foam, and it's whitish. It's a white foam that goes into the vein and kind of takes up space, moves the blood out, and does its work on the inside of the vein. You're looking at it right away. In some veins, it's almost immediate, like within seconds. Yeah. But yeah, it's very fast. It's very fast. And so that whole procedure can be as fast as 5-10 minutes, 15 minutes usually at the most. Usually I will do a little maneuvering of the exam table. In other words, shifting the patient back so that instead of kind of flat, the legs are more up. And the reason I do that, and this is recommended by the company that manufactures that Varithena foam, you will see that the veins will get smaller by simply tilting. Veins are very sensitive to gravity and change of position. So by shifting the patient back with the legs slightly up, those veins will flatten out a little bit, and it makes the foam more effective at doing what I'm trying to make those veins.